The first study I would like to share with you is entitled Trajectories of Emergent Central Sleep Apnea During Continuous Positive Airway Therapy. And you have among the authors people from ResMed, some data scientists, and Atul Malhotra from the US, Peter Sistuli, and me from Europe with Olga Vore. So this is a study flow. We decided to look at a random sample of 30% of the patients starting CPAP in the US. Again, these are US data from January 2015 until the end of the year. The initial sample was 247,000 people. We excluded people with less than one session of at least 1 hour using CPAP. The first device should be CPAP. And at the end, to summarize, we included in the analysis 133,000 people, which is clearly a very huge population reflecting the real-life situation of CPAP initiation, at least in the US. And as you can see, we can nicely separate different trajectories during the first 3 months of CPAP. You have the typical OSA patient with no evidence for central events and a global apnea-hypopnea index below 5, very stable. And we have 3 different trajectories or 3 different populations, if you want, of people with central sleep apnea during CPAP. You can see that the global prevalence of these 3 categories together was 3.5%, so it's clearly below some of the prevalence rate previously published. And you can see, one population with persistent central sleep apnea. These are the central apneas. One population with transient central sleep apnea. And you can see that using the telemonitoring, it's really easy to see whether when you have a normalization of the central events under CPAP, and you have the population of emergent central sleep apnea under CPAP. So clearly, different patterns, different trajectories that cannot be summarized by a unique measurement during CPAP titration in the lab, for example. So just to tell you, the prevalence of transient sleep apnea is less than 2%, emergent less than 1%, and approximately 1% of these people exhibited persistent central sleep apnea. When looking at a forest plot summarizing the risk factors for therapy termination in different patient subgroups, you can see that the younger people, and it is well known from previous studies, are more likely to terminate therapy in the 3 months. But also, when you have a reference of a typical obstructive sleep apnea, you can see that transient and even more persistent and even more emergent central sleep apnea is associated with a higher risk of CPAP therapy termination. You know, for the clinician, this is a major new information, because I think in your clinical practice, you consider that an RHI with 5 central events per hour is nothing. It was my experience in clinical practice. And actually, these data are demonstrating that even a moderate persistent central sleep apnea is associated with an increased risk of therapy termination. And this is, I think, a very nice figure showing with a multivariate Cox model survival the probability to remain treated by CPAP. And this is a 1-year follow-up. And you can see that classical OSA has a lower risk for CPAP termination, and then transient sleep apnea, persistent central sleep apnea, and emergent central sleep apnea. So we have identified different phenotypes during CPAP treatment, characterizing different clusters of patients with central sleep apnea that are associated with a significant outcome, therapy termination, and CPAP compliance.